Hello, this is Dr. Bob with another episode of Ask Dr. Bob. And we have several questions I'd like to answer for everybody that's been sending in their faxes and their Facebook questions. The very first question is, why flax oil for ADHD if I'm already taking a salmon or anchovy or marine oil? And it's pretty simple like this. In my book, Dr. Bob's Guide to Stop ADHD in 18 Days, I normally recommend that you only take the marine oil for about 18 days. Because at that point, the flax oil and how it is metabolized inside of your body literally starts to kick in. You see, the flax oil metabolism is only about 10% effective. So you're not going to bleed to death with it, but it's a very important cycle. Because I know all of you don't live up in Alaska, and I know that you generally are not exposed to marine fish that have high levels of DHA. So what we have found from our experience, taking a tablespoon of flax oil per day per 100 pounds is very logical, very effective. You may need B6, minerals, and zinc, and we can test for that because flax oil does require minerals to operate properly. I would suggest that maybe every year or two you might have a blood spot fatty acid test just to check the levels of the alpha-linolenic acid, which is flax oil, and the DHA that would be coming from marine oil. Dr. Bob, I have rheumatoid arthritis and carpal tunnel syndrome. I'm always sore from my shoulder to my fingertips. I have a lot of anxiety. What exactly can I do? I can't make a fist. Well, this is what I have found. Gluten and gluten products like barley, rye, oats, and of course wheat can cause inflammation in the body. We also have found that the nightshades, tomatoes, potatoes, eggplant, and green pepper can also cause tissue calcinosis. Do you ever wonder where they come up with all these names? Tissue calcinosis is actually inflammation that can occur in your tissues. So common foods, gluten can cause pain and inflammation. I can tell you from my experience that dairy and gluten and nightshades are the three biggest joint pain factors. But I also know that having optimal liver function is very important not to have pain or stiffness in the body. Dr. Bob, I've had anxiety my entire life, social anxiety. Recent example, my child broke their arm and I almost passed out. Medical issues seem to really elevate my anxiety and fear. I have scoliosis. I do see a chiropractor every couple months. I'm 45 years old. Well, we have found from our experience that probably one of the leading causes of anxiety is lack of B vitamins. I also know that you could have some psychological challenge from when you were a kid, that somebody had some major trauma occur to them and it really imprinted itself on your brain, which really has impacted your adrenal gland. You may want to do a little bit of research in your own past and really investigate that. I also know sometimes you could have low blood sugar causes anxiety, but lack of B vitamins is probably one of the biggest causes of anxiety. I would see your chiropractor regularly. I know in our chiropractic office, I practice clinically as a chiropractor. I also have a doctor of natural health degree. We see our patients more than as what we call Band-Aid chiropractic. Our patients understand our role in their lives. And having proper and optimal nervous system function, it's amazing. On any day, patients will come in, they're not feeling 100%. We give them their needed care and they feel fantastic. So I would encourage you to check into that. We had someone that contacted us from First Magazine. It's a female magazine. We've had contacts from all over the world because of it. This particular individual was taking a product called Iodine, which was discussed in the magazine. We primarily use a product from Biotics Research Labs called Iodine. She's taking about 1.5 tablets a day. She's starting to feel better, and she wanted to know if she could take more. I can tell you that I have patients that literally come into our office with baskets of products that they take because they read a magazine like First Magazine, which is an awesome magazine, by the way. We've had a couple of our patients have been featured in this magazine. There's 2 or 3 items I want you to be aware of. First, you should always have your thyroid serum test done. We look for T4. Your T4, TOM4, should be at about 8. If your T4 is low, that's a suggestion to me that you may need iodine. We also may supplement L-tyrosine with that because L-tyrosine and iodine help make thyroid hormone. But there are 2 other ways that you can check for your iodine. We do something called a urine iodine loading test, where for 4 days you take no iodine products, and then you take 50 milligrams of iodine. For 4 days you take no iodine products, you take a pre-test, that means you take a urine specimen, then you take 50 milligrams of iodine, and over the next 24 hours you literally catch your urine. You take and you shake up and you put a sample of that in a tube, and we send that off to a lab, and they tell us the amount of iodine that your body has held onto and how much your body has excreted. You should excrete about 95% of the iodine that you take in. That's because your body should have enough iodine in it, so it does not need to hold on to it. Common body signals for low iodine is cold hands and cold feet, wide spaced teeth. Typical low thyroid findings include waking up with a morning headache, constipation, wide spaced teeth, thinning hair. We talk about that in great detail in Dr. Bob's Drugless Guide to Balancing Female Hormones. She also mentioned that she uses alkaline water. I don't really promote alkaline water. I think you should eat alkaline foods. And she also said that her TSH is 1.2. TSH, Tom, Sam, Harry, TSH, is a body signal to me in how your pituitary gland is working. We like to see that number be greater than 2. If it's less than 2, we use a product called PT-HPT, pituitary hypothalamus. We usually like to monitor blood serum tests every 3 to 4 months. We encourage a T3, a T4, a TSH, and a TPL. And you could be watching me anywhere in the world right now, and maybe you don't have access to a healthcare provider. We could literally send you a kit, and we could have those tests done anywhere in the world, and we could have a consultation, and we can talk about it. And I want you to know one of the leading causes of breast cancer, according to my friend Dr. David Fram, who wrote the Cancer Battle Plan, is subpar thyroid function. The last question I'd like to talk to you about is someone contacted me, and we hear this a lot. Dr. Bob, I was reading articles that you have presented, and I want to know if you could do an article on sweaty palms and just being sweating. And I have patients that come into the office on a regular basis, and they say to me, man, I am like sweating profusely. What can I do about it? I can tell you from my experience, one of the leading causes of sweaty palms and just overall sweating in your body happens to be exhausted adrenal glands. If you crave salt, if you just have a major craving for sugar, it's very possible that the cause of your sweaty palms and your sweaty hands and just your overall sweating inside of your body is that your adrenal glands are exhausted. And I want you to know, for our experience, we use a product called superphosphozyme. I may suggest to you that what we see is that if your adrenal glands are exhausted because you have sweaty hands and sweaty palms, your adrenal glands cause your body to be dry. And then once those adrenal glands are exhausted and your parasympathetic nervous system takes over, guess what? You start to sweat. So there's definitely some ways that you could test for a weak adrenal gland function. One is called the adrenal stress index. The adrenal stress index is a saliva test that we use. You could also have your blood pressure taken from a sitting position to a standing position. And if your blood pressure drops, it's a body signal to me that your adrenal glands are literally exhausted. We encourage our patients to use Celtic sea salt. We also use something called ADB5. So if you have sweaty palms and you have sweaty hands and you're sweating profusely, you don't necessarily have to go out and get a stronger deodorant. Your challenge could be, number one, your liver is compromised and your liver is causing you to have kidney stress. Thanks for listening. Pass this information on. Bye.